The Hospice at Home Toolkit is a free-to-use online resource for hospice at home providers, members of the public, health and social care commissioners, and wider palliative care workers. Whoever you are, if you are looking for information about hospice care at home, we have something to offer you. For many people, dying at home is an important priority, and services called Hospice at Home or similar have been developed across England to support people to make this possible. Hospice at Home services aim to offer the quality and ethos of hospice care at home. They support dying patients to have a good death and offer them and their family or friend carers the choice of where to receive end-of-life care. A recent national evaluation of hospices at home in England provided evidence on what needs to happen to make the best care possible. Our Hospice at Home Toolkit is based on this research evidence. The Toolkit website provides a range of tools and resources including a service assessment, one-page summaries of research evidence for different audiences, and videos on a variety of topics. Over 100 people have been involved in designing and reviewing initial versions of the toolkit, including hospice at home service providers, members of the public, the wider workforce, and commissioners. We have a range of resources for the general public, including those nearing the end of their life and family or friend carers. For example, we have a 5-part video on what to expect if you or someone close to you wants to die at home. We also have information for family and friends on what they may wish to know before looking after someone at home at the end of their life. For organisations providing hospice at home services, there is a service assessment in the toolkit. It helps providers to reflect on their current service and consider areas where changes could improve patient outcomes. The toolkit was tested with 10 hospice at home teams in England and 1 in Canada. They found the toolkit to be useful, easy to use, and relevant to their role. In fact, 90% of those who tried the service assessment said it gave them ideas on how to enhance their service. The service assessment encourages hospice at home providers to consider various aspects of their service and how they function. It includes 24 questions in 6 areas, all based on what matters most when optimizing the service and improving patient care. The assessment is not a benchmarking exercise. It is not about comparing or judging. It simply provides an opportunity for reflection on ways in which the service may be able to develop. Only you can see your assessment answers. We do not keep any information you enter in the toolkit. After you answer the questions, the toolkit creates a spiderweb diagram showing which parts of hospice at home are working well and where there's room for improvement. You can also access evidence-based information and advice on how other hospice at home teams in England optimise their services. The spiderweb diagram is intended as a guide to sections of the toolkit which might be of most relevance. For example, this spiderweb diagram suggests that the service could do better at integrating and coordinating with others. This may encourage toolkit users to look at what other hospice at home services have done to optimise in this area. We have organised this information into specific topics and summarised successful service optimisation strategies. For those interested in more detail, we provide in-depth information with quotes from service providers, decision makers, and family caregivers. We also offer a series of videos and one-page evidence summaries for operational staff and hospice at home managers. We provide a concise list of top tips for optimising services, along with top tensions on the difficult balancing acts that running hospice at home services often involves. We also have content for service commissioners and the wider workforce who are not directly part of hospice at home delivery, but support people at the end of their life. People who tested the toolkit found it useful and relevant. The head of nursing in one of the teams who used the toolkit in our pilot has said, "It is a powerful and useful tool." A hospice at home team leader in another service said the toolkit will be beneficial to improve and expand hospice at home services. We found the toolkit to be helpful to charity sector as well as NHS-run hospice at home teams. It benefited not only established organisations, but also ones who wish to start a new service. We also tested the toolkit with a commissioner and 7 members of the public, one of whom has said the toolkit was concise, succinct, and signposts you to other areas, so you can pick what is relevant to you if you want to know more. Regardless of who you are or what your role is, if you are looking for information about hospice care at home, our toolkit has something for you. Visit our website at www.hospiceatHomeToolkit.co.uk.